good evening, everyone, and welcome. My name is Darryl Rattree. I'm the Bacillus of the Sigma Beta Beta chapter of the Omega Psi Phi Fraternity Incorporated. I want to welcome all of you to our third part in our pandemic discussion series, Keeping It Real, discussing mental health stigmas in the Black community. Of course, this is an important discussion that we should be having anyway, but given the pandemic and its impact that it's had on us, is even more important now. If you've been a part of the other two discussions, you know our panelists are open, honest, and can be asked anything. So be sure to put your questions in the chat. We are also simulcasting live on Facebook. So if you're watching from Facebook, feel free to use that chat as well, and we'll make sure the questions get answered during the discussion. But without further ado, I'm going to please bring on and welcome our host and moderator, Brother Jason Rivers.
Good evening, everybody. Welcome to Sigma Beta Beta. This is our third forum that we have focusing on the pandemic. And we've decided to take this to a topic that's really not talked about, but is basically the mental health aspect and how it can affect Black men, really. It's not something that we talk about a lot, but it's something that we need to talk about. So we have two amazing people that are joining us on here. Dr. Claire J. Green Ford, and also Brother Jeff Seeley. So Dr. Claire J. Green Ford is a Barbadian-born, New York and New Jersey-based licensed clinical social worker whose work and interests focus on the intersectionality of behavioral health, criminal justice, social disparities, trauma, and human development. She believes in the psychosocial spiritual model of wellness and is a strong advocate for holistic and culturally humble practices that consider both a trauma-informed and neurobiological lens. She has training and experience in areas including adolescence and adult mental health, policy development, and racial trauma. Dr. Claire lends her time to help support various missions and is a member of many community service organizations, including Zeta Phi Beta Sorority Incorporated. Let's please welcome Dr. Claire. Dr. Claire.
Thank you so much.
All right, and we will go on to our next amazing person on here, Brother Jeff Seeley, who is originally from Brooklyn, New York. Brother Seeley is a mental health advocate for awareness, education, and change. He is currently now pursuing his PhD in general psychology and also holds 2 other degrees in psychology and healthcare management. Brother Seeley is currently the director of psychological services for the Mercy Home, a nonprofit New York City agency, and chief consultant owner of Psych Connect LLC. Both agencies specialize in the care of people diagnosed with intellectual and development disabilities. I am now going to turn this over to Dr. Claire and Brother Seeley.
Thank you for your introduction, Brother Rivers. Thank you for moderating this event. And without further ado, let's get started.
Absolutely. So thank you so much. And again, I am extremely honored to be here. I think this is not only an important topic, but it's a privilege to be able to have this discussion during Black Excellence Month. So I want to start by saying Happy Black Excellence Month. And part of our excellence is protecting our crown and protecting our minds. So mental health, what is it? Why are we talking about this and why is it important in our community? So there's so many stigmas in our community around mental health. And as a mental health practitioner, it's part of my role to help destigmatize it. But as a person of the African diaspora, it's definitely my duty to destigmatize it because I know how much it impacts who we are, our well-being, and it's killing us literally. We think about mental health often as this taboo thing, but the reality is that there is no health without mental health. Your brain and your mind control your entire body. If your mind is not well, your body is not well. And there's such an intimate connection between your physical wellness and your mental wellness. And in this country and around the world, particularly for Black communities, our physical wellness is severely impacted by the mental trauma and the strain that we go through. And so when we think about mental health, I want you to think about the fact that there's no person on the planet outside of the person who hasn't been born and the person who no longer is here that doesn't have a mental health need. It is the leading cause of disability in the world, according to the World Health Organization, and results in billions and billions and billions of loss in employment opportunities as well as workplace. So it's not something that we should take lightly, and it's something that we can do something about. Our mental health impacts our emotional well-being, our physical well-being, our spiritual well-being, our social connections. And so it is vital for us as humans to address it because this is a huge part of how we thrive.
So I want to actually piggyback off of what you just said. So what made you go into the area of mental health? What was it that drove your passion? And Brother Sealy, you can jump on there as well after Dr. Claire to jump in there as well. So what drove your passion to because it's a thing, you know, it's not something we talk about in our community. So what made the both of you, what drove you to this passion?
My first answer is God, because my intention was to be a surgeon and I was going to be performing surgeries. I love biology, I love science, and that was it. However, God had a different path for me, and I started taking courses, sociology courses, and learning about people, psychology courses. And so I recognized that the way that our bodies work, the way our minds work, we're so intimately connected, and I could still be a doctor, just a different type of doctor. And so that's really what led me into it. And then when I started working and I saw the disparities in our healthcare system, in our justice system, in our education system, it drove me to really focus more on racialized trauma and also mental health awareness in our communities, because it's painful to watch my people suffer. And that continues to drive me.
Okay. Brother Sealy?
Yes. So my story is a little bit less underwhelming. When I started, when I was an undergrad, I originally majored in business, and I would pursue pursue a career as an entrepreneur, and then I failed microeconomics. And when I failed the class, I obviously wanted to take it again, so I took macroeconomics the next semester, and I failed that too. And I realized that maybe I should pick another subject, another major, and the major I picked was psychology. When I became immersed in psychology, truly is when I got the opportunity to volunteer in a psychiatric ward in Long Island College Hospital in Brooklyn, New York. And as a part of that internship, I was in a psych ward, and I interacted with many patients who were experiencing psychiatric distress and were obviously needed that support. So coming into that as a 19-year-old, you have a choice, and I actually felt comfortable in that environment. And when I finished my degree, I went right into work with the IDD population, as you coined it, Brother Rivers, the intellectual and developmental disability population, and been working in that field for the last 17 years. It was a job that I received right out of college, and obviously to pursue my degree, it just became very evident that I had a passion, I had enthusiasm for the field, and I wanted to learn more and contribute to my community.
Okay, so we're going to get into some of the questions that were emailed to us. So Dr. Claire, this question is pretty much geared towards you. So what are the one of the questions is, what are the principles for mental health engagement?
Yeah, definitely. So I take this question in terms of understanding as what are some of the things or steps that you need to take to engage in terms of treatment. And I think first is recognizing that we all need a therapist. Honestly, everybody needs to talk to somebody, and it's sometimes really helpful to have someone that you can talk to objectively. I would say research, right? So there are not a lot of people that look like Jeff and I that do this work, and we recognize that that's a gap in our profession and in the world. But it doesn't mean that you can't do your research to figure out, hey, is this something that could be helpful for me? let me look up and find practitioners of color, if that's something that you feel more comfortable with, whether, regardless of gender, fluidity, whatever it is, looking for people that you feel you may be able to identify with. I think educating yourself as well about mental health, about therapy, because I think one of the big stigmas that we have in our community is that if you go to therapy, you're not strong enough, particularly when we bring in religiosity and those thoughts. And I always tell people Jesus had 12 disciples and he's God. So if he had 12 disciples, why you think you don't need anybody? And so it's really important to me that you take the time, just like you would look up a plumber, right? If you would look up anyone to help with something that you need help with, you want to make sure that people are credentialed and qualified to provide the services. That's really important. You want to make sure that, one, do you have insurance to pay for it, if that's something that's necessary for that, because not everybody requires or takes insurance. You know, I think it's research is important, but also being at a space where you accept that you may need some support, and also listening to friends, family, and all those other people that may say to you, hey, something's up. So that's the way I understand the question, but I'm going to also pass that to Jeff to continue.
Yeah. So mental health engagement, the principles are, very simple. Engagement, learning how to use supportive language, and having the community using their resources that it was based in the community, and using language and active listening, reflective listening with the people that you serve, and it helps to engage a person's mental health. When we think of mental health, we think of many different factors. We, coping mechanisms, stressors, triggers, managing the everyday life. But mental health is broadly defined as, just being able to manage, just being able to cope, and stay productive regardless of what's going on around you, regardless of what's going on in your environment. And I feel that is very important that, as, someone who considers himself a professional, learn, we spread our knowledge across people who may not be unaware. I give an example. The other day I conducted a staff training, and to their surprise, they didn't know that they were entitled to a mental health day, or as a day off from work. And this is not something that is widely publicized or taught to them or told to them during new staff orientation or through any type of orientation. We just recently did an EEOC training, and those are things that not really discussed. And these were employees that worked in the facility for at least 15 years, and they had no idea. So even simple things like that, that I'm able to convey to my community or the people that I work with, it goes a long way, and it helps people feel that they're in a supportive environment.
All right, so we're gonna go to another question. So many people have been experiencing anxiety, stress, some even experiencing paranoia during this pandemic. Should people take medication to deal with the paranoia? And another part of the question is, how should people really deal with the anxiety and the stress that's coming from the pandemic?
Yeah, that's a really good question. I think the first thing is to acknowledge that we are having stress, anxiety, depression, everything we could think about as a result of the pandemic, the loss of our daily routines. We've been in this for a year, right? The human mind is not designed to deal with this much stress for this long. So I think the first step is acknowledging that what you're experiencing is real, and what you're experiencing is a normal reaction to an abnormal situation. Nothing is wrong with you for having struggles with the realities of the world right now, because we are supposed to be struggling with this. I think the other part of this question, which is really important, is should you take medications? That is best answered by your medical provider. So I can never tell you, and Jeff would never tell you, no mental health practitioner or anyone would on a call like this would say to you, yes, you should take it. There are so many factors that influence the medications you take, whether or not you have underlying medical conditions, whether you're allergic to things, whether or not it's even necessary for you. And it's best to work that out with your practitioner, a psychiatrist who is a medical doctor who specializes in addressing mental health and psychiatric disorders. It's someone that could help, a psychiatric nurse practitioner. Your therapist can refer you to a doctor that or someone that could prescribe medications, but that is an intimate conversation with you and that practitioner.
So what are some ways that people would kind of deal with the anxiety and the stress? So give an example, we all know to stay 6 feet away, social distance, we're wearing our masks, you have people doing this on a daily basis, staying home, only going to the supermarkets when necessary, but yet still people still end up unfortunately getting COVID. So that's scare for all of us. Like how do we cope with that anxiety that comes from, no matter what, I could stay safe, but yet somehow I still may contact, COVID. So how do you deal with that stress?
Yeah, I mean, that's a real concern. It's a real issue. And there are lots of things that you can actually do to help mitigate. So it's not going to necessarily take it away for every single person. It can work for some people, it may not. But I can tell you that there's a lot of research that supports that exercise, being physically active, helps a lot with dealing with stress and anxiety in our bodies. You're getting rid of toxins from your body, you're increasing your heart rate in a healthy way. And exercise can take many different forms, but there's a lot of research that supports the efficacy of exercise, and sometimes exercise with or without medication, right? And so that's one of the big things. I am from Barbados. I can be very clear. I do not like snow. The only thing I understand about snow, it should be in a cup with syrup, and that's a snow cone. Anything outside of that, I don't like, but I recognize that I need to go outside, even if it's for 5 minutes, just to go outside, right? So if you have the ability to go outside, even for 5 minutes, that is a way that you can help break up some of the pattern of just sitting in your desk all day, every day. If you have the privilege, because it is a privilege to be able to work from home and to have a job and work from home. So if you are in that position, go outside, take breaks, right? And I'm guilty of this. So I'm talking to myself too. Scheduling breaks in your day, because I can have a 13-hour day, is really important. You have to get up, you have to move, you have to drink water. Sleep, for all of you that love or your social media stuff, turn it off. It does not need to be on all day, every day. You do not need to be on CNN, BBC, NBC, all the C's that exist to keep track of what's going on. It's the same information is going to be tomorrow. How many more people died? It's going to be there. You have to be able to shut off. I would also say you have to kind of put boundaries in your life with energy vampires. Now, energy vampires are those people we love, but suck energy from us. And that could be someone celebrity, not family members. You have to be able to shut off. The only person that's going to care about your wellness in the way that it requires, necessitates the amazing human being you are is you. Not your spouse, not your kids, not your job. You have to be able to shut off and find people that you can talk to. Spirituality, so long it is not in a way that it can be damaging to you, is a really great way, and particularly something in Black communities that it's really relied upon, regardless of whether or not it's your church, whether or not it's your mosque, whatever that is. It's really important that you also engage your networks of support. And it's okay to say you're not okay. It's okay to not be okay. But they are things that you can do. Sleeping is important, making sure that if you can, you got your 7 hours of sleep. I know a lot of people are on this right before they go to bed. All that blue light is actually not good for your brain. It's actually gonna take your brain a lot longer to calm down when you are so active, particularly with gadgets and gadgets. So I do encourage for you, your kids, at least an hour and a half, 2 hours before, put it down so that you can actually get restful sleep. Water is your friend. Water is such a friend to you. I know we may not like water, but it is. And sugar is not your friend. So also being balanced with nutrition, what you eat and put into your body is also what you're gonna get out, right? If you're like sugar, get your fruits, get your, you can mix it up. Chocolate, I will never tell you is bad. Chocolate is from the cocoa plant, therefore I believe it's salad. However, there's not been proven, but it's important that you do get some nutrition in your body, your fruits, your vegetables, sleep, water, rest, movement. I'm from Barbados. Soca's going to do it for me, and gospel. Those are two things I listen to. God is still working on my heart. But ultimately, you have the choice to put some of these blockers in place to protect your wellness.
So you actually kind of tap right into the second question I was going to ask, which was tips in general that can help people focus on their mental health. So another question is, are there any costs to agencies that people can reach out to? So basically the question is kind of asking, are there agencies that people can reach out to that's of no cost? You know, unfortunately with the pandemic, you have a lot of people being hit financially hard and can't afford to get that to go see a professional. Are there agencies that people can reach out to that are no cost to them?
Yes, there are actually many agencies throughout the 5 boroughs and also in Long Island that people can take advantage of. Actually, I can post a list within the chat room so people can go to their websites, but there are, at least 5 in the Bronx. There's one in Long Island, actually, on the CW Post campus in Brookville, the Psychological Services Center and CW Post, but across the 5 boroughs, there are many. And again, this is not publicized within the community that you can go to certain hospitals and obtain free medical advice, free medical support, free psychological and psychiatric support from these centers. And it's something that it's a disparity in the lower income or the minority neighborhoods. And it's something that we have, experience for a very long time, and it's due to a numerous amount of factors. Budget cuts. There are not a lot of hospitals or not a lot of clinics operating in lower income neighborhoods because of funding going to the higher end or going to the more reputable hospitals and clinics in our area, and we as a community have not been able to take advantage of that. So our choices and our options are few and far between. And for us to be giving this information to everyone is easily sought out, but again, it's not something that your medical professional may tell you to take advantage of unless you ask. It's not something that's posted on the train like many ads for the train, the advertisements on the train, the bus, advertisers that you drive past. Their focus is to get you to spend money. There's no benefit towards them for you to if it's free or if it's a low cost. So these are things that I believe that people should take advantage of. And I'm going to post them in the chat room momentarily so everyone can take a look at it.
Yeah, I think that's really important if you could post that for people. So another question is, how has the pandemic affected the Black community? I'm sorry, why is it that the pandemic has affected the Black community more than other communities? Yeah, I'll give that one to you, Dr. C.
Yeah, I'm all over that one. That's racialized trauma right there. I mean, look, racism is real, right? So structural racism and structural violence is the birth platform for what we're seeing, right? None of the statistics that we've seen for Black communities and the Latinx community are surprising at all. The statistics that we see pre-COVID, when it comes to the certain zip codes that we know, the zip codes in Brooklyn, for example, in the Bronx, in Queens, that had the highest rates of death, not coincidentally, are the same zip codes before COVID that had high incidences of death, high incidences of poor health care, low socioeconomic, lack of access to resources, lack of access to healthy food, nutritious food, same communities, poor educational facilities, poor healthcare facilities, same story, et cetera, et cetera, et cetera. This is the wake-up call that people have been snoozing the alarm on for years, right? What we're seeing in our communities is not because of something that you as a person of color, you as a Black person has done. It's because of structural violence. It's because, to what Jeff was talking about, there's few and far resources there. That's by design, right? If we take it back to things like redlining, which still exist, right? We think about the fact that we have more liquor stores in our areas than we do healthcare centers, right? those kinds of things are the reality that has resulted in high incidences of death. Additionally, Black and Latinx community tend to be essential and frontline workers more often than not. And I want to be clear though, because there is this myth that this has to do with low socioeconomic status. When you take out socioeconomic status, Black and brown people are still dying at higher rates. So it's not only because of your money or how much access you have. Your skin color and the experiences of systems of harm have everything to do with this. Less likely, more Black people are less likely to have insurance. More people of color are more likely to not have a consistent medical provider like a primary care physician. And so those things also connect to it. Also, you're working multiple jobs for some community members, right? Multiple jobs, all of these different things that are causing you to be exposed. So my husband is an amazing, beautiful Afro Latinx man. He's a firefighter. He's an essential worker. I don't have a choice even if I'm home for not being exposed. He's a firefighter. He is one of the most beautiful people I know, but it doesn't protect him from being at risk. And so when we think about this, we are not only low wage workers, because that's a myth as well. We are in the hospitals, we're doctors, we're nurses, we're techs, different things that mean that you're constantly being exposed. That's why we have higher rates of death and why we are seeing the numbers we're seeing in our communities.
So I'm gonna go on to another question that kind of goes with what you just said. So one of the questions is that some frontline workers do not feel as if they have enough mental health support. What should they do, and how do we in general just advocate for more social support in our community?
So to Claire's point, there's a significant number of minorities or frontline workers. Actually, it's 75%. So 3/4 of frontline workers are, consider themselves to be minorities. And as frontline workers, you're, exposed, or you're exposed more than anyone else to infection, the risk of infection, to cross-contamination, to wherever, the facility or the environment that you work in. And we have to realize that there's a lot of stress and anxiety that comes with that, and a lot of, a responsibility, because without our frontline workers, many of the things that we have to take for granted, they have to go every day. They have to go through every day, like working within the IDD population, or working with the IDD population, and working within the confines of the OPWDD. Our essential workers, or our direct support professionals, had to attend work every day. And it didn't stop, whether, there was a positive case in a facility, whether there were a couple of positive cases, or someone was back and forth in the hospital. My agency in particular lost 5 residents to COVID. But those frontline essential workers did not have to stop. They did not stop going to work. And many of them were unaware of, the actual conceptualization of sick time and how they can take advantage of it. So the agency started to promote what was called FFCRA, which is a benefit of sick or leave time should you or a family member contract COVID, and it helped them out immensely. But not every agency or not every organization engages in that, or not every agency or organization or company enforces that, and it's to the dismay of many of our frontline workers, because it is a very stressful, high anxiety job, and it affects our community the most.
Absolutely. I want to jump in here because of this question about frontline and essential workers, and just do a quick plug for a resource that exists. So Vibrant Emotional Health, which is those are the people behind the call centers for Thrive NYC. They're amazing. I have an amazing friend who is a VP there. They created the New York City Frontline and Essential Workers Hotline. And that is something that is specifically for frontline workers, essential workers, community health workers who are experiencing normal stress to an abnormal situation. And that is, you can either Google like NYC FEW, FEW, or that number is 1-866-565-7715. And Jeff and myself have done resources, so we'll share. But I just want to be clear that there is a resource that exists, as well as the NYC WELL line. But the FEW line is specifically for frontline essential and community health workers.
So another question is, how has COVID changed the workplace activity? And I know it's a very general question because it's changed last. So just what are some of the ways it's changed as far as it goes in with the mental health aspect?
So let's think about what we were doing pre-COVID. Like, let's go back into the January, February, where we were hearing about it. We were hearing that it was, it may or may not be coming to the United States. And, people were kind of on guard, like, maybe, it'll affect us, maybe it won't, maybe it'll be something that they could control. And then what was the biggest factor in it was how seriously the government took it. Because I felt that it was something that played into the misinformation or sort of the distrust that came with COVID initially. Then within February and March, we started to hear more things every day about COVID. Like if you were someone who consumed a lot of media, whether it be via social media or watching television, every other story, every other minute was about a COVID case or, how it started to affect people. And then even like CNN put a COVID tracker in the corner of the screen. So you were aware of how many people were dying every day, which was very, very stressful. And what seemed to happen is, as you worked at your workplace, you started to go receive emails about, changes in work schedules and changes in meeting schedules and the cancellation of meetings and the rescheduled meetings, because at first everyone thought that this was going to go away within a couple of months. So that was initially what happened. Then, you started to get, okay, well, now you have to rearrange your entire work life and start working from home. Now, working from home sounds cool to everyone, for 1 or 2 days, but then it went from 1 or 2 days to 9 months of not being in the facility for us to have those type of positions where, we come in contact with different people every day, and, it would have been a health risk if we were going back to work. So it was something that we experienced, and it significantly changed our work life as we know it. And then, Zoom, the evolution of Zoom came into effect. People weren't really using Zoom prior to like really April. And then the evolution of Zoom, Microsoft Teams, other platforms started to, take the place of that interaction. And it became so stressful because there was so much of, anxiety around that social isolation or cabin fever, as many people experience, interpersonal conflict, trying to decide whether you're going to work all day or you're going to slack and binge watch your favorite Netflix series or your favorite Hulu series. And then obviously high levels of burnout. I mean, Dr. Claire mentioned it earlier. She, works 13-hour days at some point. And at some point, if you work 13-hour days, which translate into 65-hour weeks, you burn out. I mean, looking at the computer, taking meetings, being on conference calls every single day. So it was a dramatic change in everyone's workplace activity, and it still is affecting us until this day. I mean, at this point, I'll just be honest with everyone. I don't think we'll ever go to a normalized environment, back to a normalized environment, or it will take a number of years to do so because of what happened to us. And that is a part of collective trauma.
Yeah, absolutely. You hit it right on the head with that and the collective trauma. But it is a new normal, but the reality, Zoom fatigue is real. Right? Like it's real. Like we're tired of being on this. God bless all of us for being on this right now because it's an important topic. but we are fatigued, right? Like it is a lot of stimulation neurologically as well. We're not supposed to be staring at screens all day, every day. And no matter how advanced we are, humans need human interaction, right? So I'm going to switch it really quickly to talk about our kids. So our kids, their job is school. Their environment has changed, and school has been such a protective factor for kids, just as the workplace is a protective factor for people. For those of you who are parents, you get a break from your kids. Now you're being principal, teacher, guidance counselor, mom, dad, grandparent, referee, while trying to do your job. That's a lot. We're not designed for that, right? So we have to think of the fact that our entire lives have been turned upside down, flipped, shaken, and just nothing is settling right now, right? And so our interactions and abilities. So as much as people say it's really great to be able to work from home, to Jeff's point, for those who have the opportunity, the whole camp of people who are also recognizing loss of productivity because of the missing human interaction, right? There's something that happens when you pass someone and they're working on this project and you're like, oh, yay, da 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 da. We can't do that for those of us, again, who have the privilege to have a home and the privilege to have a job to work from home. That is something that we are missing. And we have to also acknowledge that, because there is the collective trauma that what Jeff is talking about, but it's also social isolation, which leads so much into depression, anxiety as well, right? Like social isolation is a huge issue, was a huge issue before COVID, and now it is just exponentially bigger.
So what are these different types of trauma? Like, for example, the racialized trauma. Explain more about that.
Yes. So racialized trauma is the real or perceived experience of discrimination and psychological and emotional harm as a result of the group that you're in, the racial group, the ethnic group that you're in. And so what we know about racialized trauma is the fact that Black people experience a lot of trauma for being Black. It's the living while Black tax. It's the Black tax. All of that is what it is. And while other groups in the BIPOC diaspora experience that as well, research shows that over 60% of Black Americans report at least one incidence of racism or a racial incident that has caused them significant distress. And why that's important: racial trauma and the experience of racialized trauma, again, trauma related to the discrimination, the macro, the micro, and all the aggressions you deal with because of the color of your beautiful melanated skin, means that you are experiencing psychological trauma compounded by the intersectionalities you have. Are you woman and Black? Are you woman, Black with a physical different ability? Are you man, Black, LGBTQ plus I community, with like all of those different things? So when you're experiencing this level of trauma, it directly connects to your physical well-being. So why I keep saying that is that we have higher instances of high blood pressure in the Black community, of diabetes. And I want to be very clear with you that high blood pressure and diabetes have a very strong correlation with depression and anxiety, very much. So depression and anxiety are pretty much a married couple, both miserable, but they come together as a package. They always have a package deal, right? And so the reality is that you are carrying this, and this trauma is then passed on generationally. Why are Black women in America 3 times more likely, regardless of socioeconomic status and education, to have a higher rate of maternal mortality, death after childbirth? That's why we pass those on genetically, passing depression, anxiety on to our children, just as we pass high blood pressure, diabetes, all genetically. And so racial trauma, according to American Psychological Association, the American Psychiatric Association, also carries with it very similar traits to post-traumatic stress disorder, which is typically something that we think about in terms of diagnosis as an anxiety disorder that's connected to an extreme experience of trauma that causes significant distress. Typical examples include exposure to war, rape, genocide, all of those different things. But racialized trauma has similar check marks, if you will, to that. That I always tell people, it is not post-traumatic stress disorder when it is your ongoing lived experience. Post acknowledges that it happened in the past. We are still living every single day with the reality of what it is to be Black in America. And that is traumatic. And that's what racialized trauma is. There's childhood trauma, there's community trauma connected to violence, right? Exposure to violence. There's compounded trauma, complex trauma, all of these different types of trauma, sexual trauma, physical trauma, intimate partner violence trauma. There's a host of traumas that exist, and also, unfortunately, a host of those traumas that exist together.
Yes.
So I'm sorry. Go ahead, Brother Sidley. I'm sorry to cut you off.
Well, yeah, that's fine. So to add to what Claire was saying, there's also vicarious trauma. And vicarious trauma is actually when you are internalizing something that happened to someone else. And, you know, it's many things. It's also in turn and ties into collective trauma, because collectively, when we are, you know, the social unrest, the social justice protests, the brutality, the divisive political rhetoric, we all experience together. So that encompasses collective trauma, but vicarious trauma is when you know someone who has been affected by COVID and you experience it and their grief and their pain, their, you know, their sensitivity to the situation. Or you know you are in contact or know someone or close to someone who experienced some type of sexual or some type of post-traumatic stress or post-traumatic trauma. You internalize their vicariously, you know, what they're going through. So that shouldn't go unnoticed. You know, that people experience that every day without even, you know, actually going through the situation.
All right. So I'm going to take some of the questions now from the chat. So one of the questions is, as someone who has privilege and cannot truly understand what some clients may be going through, what's a good alternative to saying I understand? You know, so this person's basically asking, you know, to say to someone I understand. What's another alternative to that, or is there an alternative to that?
There is. It is acknowledging that you don't understand, acknowledging that I don't walk your shoes. I don't go through what you go through, but I'm willing to listen and willing to be a support. And how do you need me to show up for you? That's important, right? Allyship to me, I tell people, I don't want an ally. I want an accomplice. I want a ride or die. And I want you to be willing to do the die too, right? Because we have continued to do that. We need people who are willing to sit there and also use their privilege to push forward. One of the things that I often speak about is the importance of people who are in privileged positions yielding their privilege to create moments and opportunities for equity, right? So that means you may not be the person speaking all the time. That means saying, you know what, I didn't write this paper, this person did. No, when somebody shuts this person down in a meeting, you say, why are you cutting this person off? I yield my time to this person. But when you're in a therapeutic relationship or anything with someone, you don't have to be that person to be willing to listen to, validate what they're saying, and also acknowledge your gaps. I'm not a man. I identify as a woman. I will never know what it's like to be a man. I will never know what it's like to be a Black man. But when my beautiful, amazing husband talks to me about his experiences, I listen. Do I experience vicarious trauma? Do I get mad? Do I want to fight everybody to upset him? Yes, and I'm not a fighter. However, I know that the opportunities where I get to listen to him and my other amazing Black friends and male mentors and friends and people I consider my brothers, it is a space of honor for me and a privilege for them to even allow me into the space to share with me what they're going through. When you operate from a space of acknowledging the humanity of someone else, acknowledging that is a privilege for you to be able to even listen to their story and sit in that space, I think that is true partnership. And that is how you work to become an accomplice, not just an ally.
Yes, and to your point, Claire, when we talk about support, it should come from all the ethnicities. It should come from all support groups or anyone who wants to know or help with your struggle. Oftentimes, when I engage with people that I work with or people that I work for, provide services for, first thing I ask is, how are you feeling? And I feel that that's a question that is rarely asked to us, and by us. And what I mean by that is saying, like, asking someone who's close to you when you check up on them or when you call them, how are you feeling? Sometimes when we call people, we text people, texting has become very interpersonal and very quick, like get to the point, like you actually text someone like what you want from them immediately and they must respond immediately back. And it's taken all the relationship is kind of like, diluted the relationship building amongst our community. But in reference to that, I want to bring up a story, a clip that I saw on social media the other day, where a Black actor was being interviewed by a Caucasian reporter, and the Caucasian reporter asked him, you being a Black actor, how do we stop racism? Like, how do we do it? And the Black actor replied to her and said, well, I don't know. I was born in 1989. Racism was here before I was before I was born. Like, you tell me how I stop it. You're older than me, or you can do your research to try to how to stop it. But the onus that she put on him to be able to understand not only what racism is, or talk about his experience, but know how to stop it, was very unfair. So when we speak to people, it is very important to listen. Regardless if you understand or you don't understand, the point is that you want to understand. The point is that you're committing, to help that person. And I think that is something that's undervalued in our community. Claire mentioned earlier, and I'm from Barbados as well, and I'm in a parish called a town called Black Rock, and everyone who knows about Black Rock knows about Jenkins, the psychiatric hospital. And Jenkins is something that my grandfather like often talks about till to this day about. The people that were mentally ill, they would send to the psych ward, whether they were disabled, whether they, would walk the streets at night, they would send it. So it was something that was very taboo in the Caribbean community and looked down upon, actually. So if someone had a problem, they didn't know how to talk about it, or they felt that, okay, if I talked about it, they're going to send me to the hospital. And growing up in Brooklyn, and this is like kind of old school, every time I would do something wrong or do something abnormal, my grandmother would say to me, I'm going to send you to the G building. And, the G building was a psych ward in Kings County. So, and I automatically connected that connotation to G building, the psych ward. And I realized as a kid, I didn't want to go there. And as you grow up, you have that perspective of, oh, the G building is bad. The G building is where they send crazy people, and it's something that is ingrained in our culture, and it's ingrained in our family dynamic, and we really have to do a better job of conveying better information to our kids. I have 2 teenage daughters, and I talk about mental health all the time with them. I talk about expressing themselves, and they're at the age, they're teenagers, they're at the age where they're very emotional. And as a father, I try to be there with them regardless of what's going on with me. I try to be a supportive person for them, regardless of whether I agree with, or maybe I think they're being dramatic or something like that. It's still being able to have someone older than you or more experienced than you to listen goes a long way.
All right, so another question we'll take from the chat. There is a prevailing sentiment amongst many, especially in the older demographics, that today's youth are softer, less testosterone in men, less handy, etc. What does science say about this, and what are some techniques to build upon one's resiliency?
Yeah, that's a really great question, because I think that it allows us to kind of touch about the stereotypes that we have and the stereotypes that we've carried and the baggage we've carried generation to generation. To what Jeff was just talking about the G building and like about Jenkins, like these are stereotypes, right? And so, yeah, there is this stigma. Do we have a generation that doesn't work in the same way that older generations did? Yeah. because the technology that exists now is different. The experiences that exist now is different. It's not lazy, it's a different work, right? People before had to work more with their hands in many regards, right? We didn't have some of the technology and tools that we have now, right? People, you needed to send a letter in the mail to get it to somebody and have pen pals. You send a text in 0.3 seconds and that can be in India, right? So I don't think it's we have different or less sturdy generation. I think we have to acknowledge that the time is different, right? So even those who are older right now are more seasoned. I can do not have the same experiences as people from 100 years ago, because when you were growing up, the technologies, the society, everything was different from then. So I think we have to acknowledge that. What we do have and what research does show is that we have a generation, yes, that may be more instant microwave, I want it right now kind of, yeah, that's reality, because we grew up with everything at their fingertips, right? Like, so we didn't have that. You have to go outside and play now. People like this all sing all day long, right? Like, we have to acknowledge the differences, but also honor the differences. We have a generation that is more open to talking about social justice issues, and we don't give credit to our young people. Many of the major social justice movements that has happened in this country in the last few years have been led by youth. Remembering what was done in the civil rights era in this country, I say to people often, we saw with the necessary social justice marches as a result of exhaustion from Mr. Floyd's murder and everything, all the injustices, that was led by young people. And that mirrors, and they were able to galvanize people in ways that weren't before. We saw this across the world because of the use of technology, because of the connections, using platforms to hold CEOs and companies accountable in a way that was never done before. So I think we need to give honor to our youth and recognize that many of the amazing characteristics they have has been passed down generationally, right? It looks different from 1965, but my God, millions and millions of people, legislators were resigning, accountability, everybody wanted to have an inclusive Black Lives Matter statement, and then people were called to task. You're putting this out, but your whole board is white. That is action. And it's a different action. They didn't necessarily take to the streets only before. They took to the streets and they took to Twitter, they took to TikTok, they took to Facebook, they took to Insta, and they got change. We get to honor our youth and create a path of recognizing that our strengths look different, but they're still strengths.
Amen to that. So next question, how do you balance getting enough sleep faced with severe night terrors? You know, there are people that are facing that. So how do you balance getting enough sleep with facing that as well?
So sleep is, obviously during this time, everyone's sleep is disturbed. Everyone's sleep has been affected. I can speak honestly for myself that there are often times I'll get up at 1 a.m. and then not go back to sleep until 5 a.m. after working all day. And insomnia is, again, another state that we often don't talk about, or we often don't try to embrace and try to fix. And there are, different things that you can do to get enough sleep. But the most important thing is being able to unplug. Being able to unplug, being able to, reduce your blue light. There's actually a something on your phone that, like reduces the blue light so it won't affect you as much at night. And, you can do simple things like putting yourself in a dark room, or, putting this TV on a sleep timer, just leaving your phone in the other room, because we've become so attached to our phones, we want to know what's going on every minute, whether it's at 10 o'clock at night or at 3 a.m. in the morning, and we do really look at, living the microwave generation, to where, everything is fast. I mean, you have like social media sites like Twitter that's faster than the news. So you'll know what's going on, or like, it's another app that, can tell you what's going on in your community, where the police alerts are, or if there's been a shooting, or if there's been something, related to that fact, quicker than the news. And we've become, hypnotized that type of information. So when we factor that into, you know, our sleep schedule, we factor it into us getting enough rest. Remember, if you don't get enough rest, you're going to wake up groggy. You're not going to be able to, you may not be able to be productive the next day, or sooner or later you may crash. Sooner or later throughout the day, you may decide, you know, I'm tired. You're going to take a nap throughout in the middle of the day and not accomplish your task. So, you know, sleep is something that is normal, just like stress. We have to embrace that sometimes we're going to be up, but we have to be committed to fix it. We have to be committed to, you know, put ourselves in position where we're getting like 7 to 9 hours of rest, you know, or sleep per day. And we have to, you know, tell the people around us that, you know, the same thing, or share this information so they're able to get, you know, the same recharging as well.
Yeah, definitely.
So Dr. C, I'm going to throw this question. I'm going to throw this one at you. This next question is for you, Dr. C. So as a first responder, I've had the privilege of being vaccinated. What is the best way to deal with people who want it but aren't eligible yet? So there are definitely people who want the vaccination that are not up for it for a while. So how do you deal with people that want it, yet there are all what they see on the news of the first responders who's received it, and then the people who are now in the 1B? So how do people cope with that?
Yeah, I mean, that's a real thing, but I want to really quickly to the night terrors. If you're having night terrors, that is a potentially underlying sign of a psychological dis-ease that you're going through. And so you may need to reach out to a professional or someone for help, right? So Jeff has talked about some of the normal things that you can do. And we talked about it earlier: exercise, sleep, drinking water, nutrition. However, if your normal routine is being interrupted by things like that, that could be a sign of anxiety and something else going on for you. So I would definitely say reach out and get help. Talk to someone, because night terrors are not normal, right? Like that's not, and it's disturbing. We know when we need to reach out to help when there's a disruption in our normal everyday patterns and routines. When you're not recognizing who you are, something about you is off, and you recognize that, that's when it's time to reach out to help. The very moment, not waiting for it to fall off and the car blew up. Like the very moment that check engine light comes on, get help. Back to the question about first responders. Look, I mean, I think it's acknowledging that piece, right? Like, so the reality is that the governor of New York and those people have created, like in all governments across this country, different schedules, right? They have been expanding what categories of people can get vaccinated. But I think one of the best things is to direct people to the New York State Gov website, where they can literally put in their own thing, am I eligible? And it'll tell people if they're eligible. One of the things we have been seeing, though, and there's been lots of reports, is that Black people are getting vaccinated a lot less, right? Or that they've been influx of people not from a community going into a community to get the vaccine. We've seen a lot of reports recently about white people going into predominantly Hispanic and Black areas to get vaccinated, taking vaccines from people. So we have to acknowledge that as well. There are many failures in the system that are allowing that, but also acknowledge that you are in a position as a first responder to get this vaccine. And there's a reason, because you're interacting with the public a lot more. It's not your fault. So if there is any kind of guilt about that, it's not your fault. This is the profession that chose you, that you were chosen to do. And so you have that opportunity, but there are many more classes of people as they continue to expand. And the best way to me is go to the source, which is the NewYorkState.gov website, put in the eligibility calculator thing, and it will tell people if they individually are eligible. Because sometimes people have thought they're not eligible, but then they find out they are.
So, okay, you said something right there, that you said that we have the Caucasians coming into our community taking the vaccine.
Mm-hmm.
But if we're not signing up for this vaccine, they're going to do that. Yeah. We have a good amount of African Americans who are scared of this vaccine. That's that's part of it. I'm not saying that's the major part, but that's something that we do have to acknowledge with our own community. If they're coming from, so in New York, if you're coming from Dix Hills, or you're coming from all the way out there to come into Brooklyn to get the vaccine, some of it is because the mindset is that people are afraid to take it. So how does that play with the fact that we have to really acknowledge that we do have people fearful of this vaccine? There are people who are waiting for others to take it to see what happens to them in the next couple monmonths.
That's normal. That's real. Jeff, do you want to do that?
Let's look at the numbers though. New York City, 24% of New York City are Black. 24% of the population is Black. However, 11% of that population have taken a vaccine compared to 45% of the white population. Now, another striking statistic is of the 65 or older population of the Black community, only 9% of our community, 65 or older, have taken the vaccination, meaning have taken the first dose or both doses. And that's striking. And that plays into, our community's distrust of the government and our community's distrust of information. Now, there have been many, workshops and many, conferences and forums just like this, where, the information has been put out there, and many of the community receive the science behind of the vaccines. And, I actually spoke to my doctor today, and he said that, there's the efficacy of each vaccine, there's really no difference to it, because difference between the three of them, because they all work. However, there is a sort of panic when you mention it to people. Like myself, working in the with the IDD population, we have created a structure where all of our residences, and I oversee like 13 programs, where people in those 13 programs we've made a way for them to receive the vaccine. However, many of the people that they work with are not receiving it. And what's more critical is that you have our direct support professionals who are not interested in taking the vaccine, but you have their supervisors, you have their managers, you have, their other clinicians who visit the residents, who've told them, who obviously have more access to information, have told them that they're not taking the vaccine either. And many of these people are within the Black community. So when you're hearing it from people who are, obviously access to information, or, have the opportunity to attend workshops or forums like this, and they're telling you that, well, I'm not taking a vaccine, I don't care about that, I'm not, engaging in that, then you're gonna have people who are not as fortunate to receive information, or don't have as many resources that we have, they're gonna make the same decision. And that's where the breakdown is, and for other ethnic groups to know this about us, and know that they can take advantage of going to Brooklyn, of going to certain parts of Queens, and going to certain parts of Long Island, wherever they live. And I've heard of people like driving from out of state to come to New York to take the vaccine. That's unfortunate. And we have to realize that the COVID has affected our community, like I said, significantly, like 22%. Like the country is made up of 13%, roughly 13% of our community, our country population is Black. 13%. Of that 13%, COVID affected as much as 23% of our community, meaning 23% of our population passed away from contracted COVID. And many of those people who contracted it live in those lower income, not as the neighborhoods not accessible to healthcare. Many of those people like passed away or died because they weren't receiving that type of care. So those are things we have to look at. Those are things we have to do a better job at. And of course, it's your choice whether you want to take the vaccine or not. But as everyone publicizes, when you take the vaccine, you're not only taking it for yourself, but you're taking it for the people around you. And those are the decisions we need to make.
I do want to add into
No, go ahead, Dr. Green.
So it wouldn't be me if I don't also do the other side of it, because everything Jeff said is accurate. But I'm a social worker. I'm a social justice warrior. And for me, it's also acknowledging that we have years and years and years of divestment in the Black community when it comes to the healthcare system. The healthcare system in this country has not been a system of health. It has been a system of harm. The apprehension about accessing the healthcare system, medical health, physical health, psychological health is real. We have to acknowledge that, right? People, there are too many research studies, we don't need any more, that show that when Black people engage with the healthcare system, they don't get help. They're ignored. They do not get medications that they need. They are often delayed in treatment. Those are real experiences. So we have to acknowledge when we say that people are not getting the vaccine, that people are also carrying that community trauma, that lived experience with them. So why would I trust you when you tell me that you want to help me when I can recall the stuff about Tuskegee experiments? And when I went to the doctor last week and I sat there for 5 hours and you ignored me, but 3 white people came in and you saw them first. Those are real. As a mental health practitioner, I have seen the reality of the bifurcated healthcare system. I've seen that my 5-year-old that's been sexually assaulted, that has private insurance, more time with me than my 5-year-old who's been sexually assaulted that has Medicaid. Both babies have been sexually assaulted and traumatized. But even to that level, we say your level of determination for just acknowledging your humanity is determined by your financial resources, what neighborhood you come from. So we do have to acknowledge that it's not coming from nowhere why there's a distrust or why people are apprehensive. The other thing is that this is not just New York. We have seen these reports from Florida, from California, and many spaces. So it is not unique about the white flight into these areas, from the areas into the areas to go back, right? So we also have to acknowledge, are there issues of technology, broadband, resources? We've heard the stories of people paying people to do the stuff for them, right? Like, because the websites have been so confusing and so many different ways to sign up. So people have paid people to do it for them, to sign up for them and to go on all the websites. Some people in our communities don't have that. It's about access, right? So yes, people have found out, oh, this community has it, but they had the wealth, the knowledge, and the resources to get there, to sign up and get those things. And we have, and that is also a systematic issue, because it's, again, a reminder of white privilege. It's a reminder of systematic violence and structural racism, but that's also, it's not unique to New York. So while I would say that many people are apprehensive about the vaccine, and they have a right to be, right? You have a right to be skeptical about anything you want to be skeptical about. If you feel more comfortable waiting to find out more information, that's your prerogative. To honor those experiences as well, because there's a lot we also still don't know. And I think one of the best ways that we can help break down that barrier is to just listen and acknowledge when people are like, I'm not comfortable with this, instead of trying to like convince, right? Because we don't know. We're also convincing from a space where we don't have full information, right? And we don't, so it's important to acknowledge that, but also recognize that the issue of people from other communities going into our communities to take the vaccine is not just because we don't want it. It's because there are real barriers to us being able to get there in the first place.
Agreed. Brother Ratcher, you said we have a question from Facebook. You want to bring that question out to Brother Silly and Dr. Claire?
Yes, Brother Rivers. So the question is, we all know that friend or family member that appears to need help. How can we support them or convince them to speak to someone? What role should we take when they are resistant?
Okay. So again, information, education is powerful, but you know, we mentioned earlier about using supportive language to get through to people. And, you know, sometimes you have to, you know, conceptualize an experience to them that they can relate to. Like, when I speak to people that, you know, I would speak to someone who, you know, maybe diagnosed with IDD or diagnosed with another psychiatric disorder, you know, I speak to them in a way that they can, you know, understand. When I speak to other people like friends or family members about, you know, the harmful, you know, seeking help and why you should, you know, consider take something serious, you know, I speak to them in like in terms of like, you know, being, you know, obviously there for them, but also, you know, speak about something I may personally be going through. One of the things I often bring up is I'm diabetic and I have type 2 diabetes. And I always worry about, you know, as far as like contracting COVID, like, you know, maybe it'll affect me more than, you know, it'll affect the next person or a family member or a friend who doesn't have diabetes. And, I try to convey that personal information and all that relatable experience to make them feel that, wow, if he's really comfortable in talking like that, and he's really disclosing that type of information, and what am I hiding for? Or what am I, so reluctant to do it? And if it's like a basic mistrust of a hospital or a mistrust of a doctor, and, I'm afforded the resources and the information to be able to help someone that may not be aware of certain things, then, sometimes I'll say, I'll go with you. Or sometimes I'll say, I'll find a friend that you can trust. So, or I'll find a friend of mine that I know you can trust, because, that's something that's going to make you feel comfortable. When you're dealing with family members and friends, you have to take your, everything, the characteristics of your relationship, and use them to your advantage. Like, my grandfather will respond maybe mightily or fairly to male doctors, but female doctors, as long as he can flirt with them, he will respond to them. And it is serious. It is serious. If he meets a young female doctor, he'll probably do whatever she tells him to do. But me knowing that, me know how to reach him. And it's not something that, I don't want to say it in a discriminatory way, but, it's something that you have to use, things like that to your advantage, because, like, people fear what they don't understand. And, it's true in every facet of life. So, we to get a friend or family member to commit to something, we have to use ingenuity. We have to be creative.
Yeah, but also go from a space of love, right? So Jeff is right. Like, we have to provide different opportunities and provide resources and do the warm handoff is what he's really talking about. Like, I can go with you, or I can try to find someone for you. But we have to acknowledge when people are not ready, right? And it's okay when sometimes people are not ready. You have to be able to have boundaries for yourself too, right? Oftentimes we want someone to do something and they don't do it, and we're angry, we're frustrated, so we get, that's not helpful, because what you're then giving off is, I can tell you, my husband will tell you this, right? Because I want him to stop speeding. It's not working. However, the reality is that I can't force that, right? Like, I can say what my concerns are to you, but we can't force it. Think about for you. If somebody is forcing you, or you feel forced to do something, are you going to respond, right? Think of it like when a 2-year-old doesn't want to do something, they're little bullies. They're cute, but they're little bullies. They're not doing it. They tell you no, they're not doing it. And you have to, what are you going to do? Argue with a 2-year-old? You will never win an argument with a 2-year-old. Don't even try. No point. You will lose. So the reality is that you have to kind of go from it in that space. Not that they're 2 years old, but the same patience you have to have with a kid, the same, like, all right, I'm going to bring it, like, that's the way, because you also have to have the boundaries. And one of the things that's really healthy and important too, also, I am not your therapist and I can help you to this, but I can't listen to this anymore. We somehow feel that we have to keep going and doing. If someone is not ready, it's okay for you to drop that card. It doesn't mean you don't love them. It doesn't mean you don't care for them. It means that you've recognized that you're barking up a tree that's not ready to drop. And that's okay too. You have to have boundaries so your wellness is not impacted by you're trying to convince somebody to do something that they're not ready to do. If your trainer tells you do 20 burpees and you ain't in a position to do 20 burpees, ain't gonna happen.
That's real talk. So we're going to begin to wrap this up, and I'm just going to ask each of you. I'm going to let Brother Sealy, you're going to go first, and Dr. Clay, you can go afterwards. Basically, you guys dropped a lot of jewels on us for like the last hour. A lot of great information, a lot of things to think about and talk about. So basically, what is it that you want people to walk away from this forum about mental health? And brother, soon to be Dr. Sealy, I'll put into existence, because I know you're going for your doctorate. So soon to be Dr. Sealy, what do you want people to walk away with? And then Dr. Claire, you can go after him, and what is it the two of you want everyone to walk away with?
So, I hate to be cliche, but, I did watch a movie the other day, Judas and the Black Messiah. And, you know, the point phrase within the movie is that where there's people, there's power. And where there's education, there's also power. And this is a tool, or this is something, a forum that we wanted to create just to put that information out there, you know, just for people to be comfortable to, you know, let others know what they're experiencing, you know, not to be afraid of any ridicule or a backlash, or, you know, any type of bullying or anything, or, you know, just trying to be made feel bad because you're experiencing this unknown pain. You know, oftentimes mental illness can be the invisibility, because, you know, you don't see it, but you can feel it, you know. And it's very important that, you know, as our people within our community, that we take care of each other. So education is important. Also accountability. Like, you know, Dr. Claire mentioned, boundaries are good, but we have to be accountable for our actions. And if we put into the air that we don't care about mental health, then guess what? The people that we're taking care of, the people that we're interacting with every day, they're going to say the same thing. So you have to be accountable for your words, and you have to be accountable for your interaction. And the last thing that I will say is really important is an advancement, is using this information to talk and share with others and advance the conversation, because it shouldn't be that, you know, this is the only forum that you're gonna, you know, talk about or kind of view what mental health is. This is something that, you know, you can Google anytime throughout the day. Like, Google is a wonderful tool where you can look up just about anything. And, you know, we have to use that as our advantage. So, you know, those are the tools I want everyone to leave with. I mean, you may have thought we've been talking too much. You may have maybe thought we've not talked enough. But if you leave here understanding something or learning something that you didn't know prior to 8:30, then, you know, I feel that our job is accomplished.
Amen.
Beautifully
Dr.
said.
Claire.
Yeah, so I'm going to say that I want you to take away the fact that there will never be another person like you on this planet. And you are uniquely, divinely, wonderfully, beautifully made. And in order to protect the amazing gift that you are, you got to protect your crown. We are who we are. Our minds dictate the way our bodies function, the way we interact with our loved ones, the way that we do well in school, work, everything. Your mind and your brain are so, so important to your wellness. And you have to be the most important person to yourself. It is not selfish, it is self-full to care about yourself and put your wellness first. Reach out for help. I know sometimes it seems like it's difficult. I can promise you, I've had difficulties finding, providers, because all the ones I know that I really like are my friends. But the reality is that there is still help. There is hope. Healing happens. We heal. Resiliency is something that I think is comes up a lot, but the reality is our minds are resilient, and you have help. There are people, forums. Educate yourself. It's so important. And also challenge the stereotypes. When someone says to you, "Oh, you're weak because you're crying and you're upset," and all this different stuff, I want you to challenge them, because you're human. So there's a saying, and I'm going to not quote it exactly, but it says that our crying has never been a sign of weakness. From birth, it has been a sign that we are alive. Call that the doctor needs to hear when you are born is you screaming and crying. It doesn't mean you're weak. That's strength. That's how they know your lungs are strong enough for you to breathe on your own. I want you to own your humanity in a way that you recognize, acknowledge, and walk in your kingdom, your queendomness, and recognize that your crown is what you have and the gift to the world. So I want you to protect your gift. And by protecting your gift, I want you to take care of your wellness and those around you. But self-full so you can be selfless.
Okay, so we want to thank you again, Dr. Claire, for giving us your time, Brother Sealy. Now we're going to take this final part of our program, and we as we are a Christian fraternity, we're going to go to the Lord in prayer. For those that would like to stay on, please stay on. For those that prefer to to head off. We want to thank you for staying with us, but I'm just now going to ask Brother Eddie O'Neill if you will unmute yourself, brother, and just bring us home in prayer.
Let us go to prayer. I trust in God wherever I may be, upon the land or on the rolling sea. But come what may, from day to day, my heavenly Father watches over me. Most gracious and eternal Heavenly Father, it is because we know that you consistently watch over us that we bring these petitions to you this evening. Lord, give us the grace to hear your voice and the strength to continue working for your kingdom. Thank you for this evening of mental health edification and the sharing of knowledge to the benefit of our village. To our brothers and sisters who have been impacted by the COVID virus or with mental health issues, we pray that God's healing hand may rest upon you. To medical doctors, nurses, and the supporting staff who are in the front lines of this fight, may the good Lord sustain you and inspire you to render your life's serving services with due care, love, and compassion. To all those who have lost loved ones due to the coronavirus, and to those who are experiencing mental health issues, we pray that their souls, through God's mercy, may rest in eternal peace, and that he will continue to bless you. But, oh God, we ask a special blessing that all of us that can be kept from all hurt, harm, and danger. In your mercy, dear Lord, grant us the strength to rebuild when all seems lost, and the courage to reach out to those in pain. It is in the matchless name of your Son, Christ Jesus, that we pray this prayer and submit these petitions. Amen.
Amen. So in the chat, we have a whole bunch of information and resources that are in there. Please feel free to copy those websites down. We want to thank you all for joining Sigma Beta Beta. I'm going to turn this over to our Bowser's brother Rattray, as he will close us out for the evening.
And what we'll do as well is we'll take the links that are in the chat and we'll post them to our Facebook page. So expect to find a post with all the links on our Facebook page as well, in case you don't get to copying them. I do want to start the closing with: crying has never been a sign of weakness from birth. It has always been a sign that we are alive. Thank you, Dr. Claire, Dr. C, for saying that. That definitely touched me. A huge thank you to our entire panel, Dr. Claire, Brother Jeffrey Seeley, our moderator, Brother Jason Rivers, and to Brother Eddie O'Neill for that powerful, powerful closing prayer. Thanks to everyone that came out to join us tonight. And thank you all for the support that we've been seeing, both on social media, folks contacting us about the next discussion series. These are very important topics for our community, for our neighborhoods, and it's information that we should definitely share. So thank you for coming out. Look forward to seeing you soon. Have a good night.